Hello student, today we are going to continue our topic Salmonella from Enterobacteriaceae. I am Dr. Sharad Deshmukh from S.H. Jaiswal College, Arjuni More. Today we will see the next part of the Salmonella, that is the pathogenicity, which is the most important aspect in the Salmonella. So as far as the pathogenicity is concerned, they produce the three types of the clinical syndromes. The Salmonella mainly responsible for the three types of the clinical syndromes. It includes enteric fever, then septicemia, and food poisoning. We'll see one by one about each, that is enteric fever, septicemia, and food poisoning. First, let us come to the enteric fever, or combinedly we can say the typhoid and the paratyphoid fever. So in this case, we call the typhoid fever when it is caused by only S. typhi, or paratyphoid fever, it is caused by the paratyphi species, but combinedly we referred it as enteric fever caused by the Salmonella species. So this enteric fever is caused by the Salmonella paratyphi A, Salmonella paratyphi B, and Salmonella paratyphi C. However, there is no S. paratyphi C in our India. Only the S. paratyphi A and paratyphi B are seen, and among them the B is the very rare one. So the source of infection for the enteric fever is mainly the contaminated food or water. So it is transmitted by the consumption of the contaminated food or the water. Mode of transmission is the ingestion mode. As the human consumes the food and drink the water, if it is contaminated, by ingestion mode it is transmitted to the human being. And incubation period for this enteric fever is about 7 to 14 days. Next, let us see the pathogenesis, how it spread, how the disease, how it occurs. That is the pathogenesis of this infection. First, when the contaminated food or water is consumed by the human being, it enters into the gut and organism get attached to the epithelial cells of the intestinal villi. Then it will penetrate to the lamina propria and submucosa, and ultimately it is phagocytosed by the macrophages and neutrophils. As far as the cells that enter, the bacteria enter in the lamina propria and submucosa, they get phagocytosed and they are entering into the mesenteric lymph nodes, where they multiply and reach the bloodstream via the thoracic duct. And there they will set the mild bacteremia, the first one. And ultimately, next they will reach and affect the various internal organs like liver, gallbladder, spleen, bone marrow, lungs, lymph nodes, and kidneys. They are mainly affected, as a massive bacteremia occurs with the onset of the clinical disease. Here it can be outlined as follows: the pathogenesis. You can see here the ingestion of the contaminated food or water, where the Salmonella bacteria that will invade the small intestine and enter the bloodstream, first one, and they will carried by the WBCs in the liver, spleen, and the bone marrow. We have already seen the various organs they are affected, where they multiply and re-enter again into the bloodstream. Now after entering the bloodstream, the bacteria invade the gallbladder. They will reach the gallbladder, biliary system, lymphatic system, and the bowel, and multiply in high numbers, very high numbers, and ultimately they will pass into the intestinal tract and can be identified for the diagnosis in culture from the stool, which is tested in the laboratory. So constantly they are shedded into the stool. Now coming to the characteristic of the typhoid fever, that is the clinical symptoms what are seen in case of the enteric fever. So it includes mainly the step ladder fever. That means the fever is in the step ladder pattern. Not immediately there is a onset of the fever at a high grade immediately. There is the step ladder fever. Then the headache is also one of the most common symptoms. Then there is the spleen become palpable. Then there is a poor appetite. You can say there is a complete loss of the appetite which is seen in the patient suffering from this illness. There is generalized aches and the pains which are commonly seen in the patient of the enteric fever, while the other symptoms also includes there is a lethargy, then the diarrhea also occurs, and there is a characteristic rose spots which are seen on the skin. It is within 2 to 3 weeks when the fever setups, and if the fever sustained, it is very high as 103 to 104 degrees Fahrenheit, or if you count in the Celsius, it may be up to 39 to 40 degree Celsius. So there is also the chest congestion which is developing in the number of patients. Most of the patient will complain about the chest congestion. There is abdominal pain and discomfort, which are the most common symptoms which are observed in the patient suffering from this clinical illness. There is also the constipation. There may be the mild vomiting. There may be the slow heartbeat rate, which is very slow, which is seen the characteristic feature in this case. So as far as the time frame is concerned, you can see here there are the 3 stages of the fever. There is the first stage of typhoid fever, second is the second stage of the typhoid fever, and next is the typhoid stage. So in this way it will have the 3 phases. Let us see the first stage, that is the first stage of the typhoid fever. In this case, you can see the characteristic feature, that is the beginning stage. So this is the beginning stage, which is characterized by the high fever. There is the fatigueness, then the weakness, the headache. There is also the sore throat, diarrhea, constipation, pain in stomach, and a typical skin rash, particularly on the chest and abdominal area, is seen in this stage. In adults, which are the most likely to experience the constipation, while in children, generally they experience the diarrhea, which is commonly seen in the children. Now coming to the second stage of the typhoid fever, which includes the, or it is characterized by the loss of the weight. There is a high grade fever, there is a severe diarrhea and severe constipation. We have already seen in the early case also, the first stage also, there is diarrhea and constipation, but here you can see there is a severe diarrhea and severe constipation which is observed in the second stage of the typhoid fever. Also there is the abdominal region appear severely distended, that is, it is the swollen form, which is the most common characteristic seen in the second stage of the typhoid fever. Now coming to the last stage, that is the typhoid stage. In this case, particularly in the typhoid stage, when it appears, there is the typhoid fever that will continues, and particularly in the untreated or more than 2 or 3 weeks. If the patient is untreated for more than 2 or the 3 weeks, the affected individual may be delirious or unable to stand and move. You can see here very the complex one. They are unable to stand as well as they are unable to move if the patient is not treated in the time. And the eyes may be partially open during this time. This is the very severe form of the symptoms are seen if the patient remain untreated. So it is necessary to diagnose the patient clinically initially so that they can be treated early and they cannot face the severe complication of this disease, that is the typhoid stage. So here we will complete about the enteric fever, and at this stage there is a fatal complication may emerge if it is not treated in time. So we'll stop here and we'll continue in the next lecture.